Hi everyone, my name is Brianna Wingrove, and for my capstone presentation I chose What is Health Information Exchange? The learning objectives for this presentation are to be able to define health information exchange, explain how health information exchange can reduce costs in healthcare, explain how health information exchange make healthcare more effective, be able to define the benefits of health information exchange, and lastly, be able to list the three key forms of health information exchange. Going into my capstone from the start, my research questions were how can health information exchange reduce the cost of healthcare, and how can health information exchange make healthcare more efficient? Within this presentation, I've answered both of these questions as well as added more information to support this. Health information exchange, also known as HIE, is the transmission of patient health information and data among different medical facilities, providers, and patients electronically. Health information exchange can give doctors, nurses, and many other healthcare providers, as well as patients, secure access to their vital medical information electronically. HIE can help improve the speed, quality, safety, and cost of patient care. Health information exchange is utilized by providers, nurses, and other healthcare professionals such as pharmacists, dentists, anything of that sort. They can use this to view a patient's medical records and see what treatments they have had, what medications they're on, view any lab results or orders, as well as any tests that have been completed. Patients also have access to health information exchange to view their own health information and view it and get an understanding of their health plan and know what's going on. And they can also update information that may be missing, or if they see something that's wrong, they will know. And this will help the patient not have to describe their history every time they go to see a doctor. Currently, there are three key forms of health information exchange. Those include directed exchange, query-based exchange, and consumer mediated exchange. Directed exchange, which is the first key form of HIE, is used by providers to easily and securely send patient information such as lab orders, results, patient referrals, or discharge summaries directly to other healthcare professionals. This information can be sent through the internet in an encrypted, secure, and reliable way amongst healthcare providers. These providers will know and trust each other already, and they commonly send secured emails back and forth to one another and share patient information. This form of information exchange enables coordinated care benefiting both providers and patients. The next key form of HIE is query-based exchange. What query-based exchange is it can be used by providers to search clinical sources on a patient. This key form is mostly used whenever there is unplanned care that the patient is receiving, like if they were to go into the emergency room and the doctor that they are receiving care from doesn't know a past history on the patient, such as medications or problems that this patient may have or reactions that they could have to a medication. If they've already had tests completed and all those things, the doctor would be able to use this key form to look up the patient's history, especially if the patient isn't awake and able to communicate those things to the doctor. This would allow them to see all of this information and prevent mistakes from happening, as well as provide a better course of care and allow the patient to receive the correct course of care. Another example for this is if a pregnant patient was to go to the hospital. Query-based can assist the provider in obtaining her records from her pregnancy and make a safer decision about what to do with that patient while they are in the ER. The third and final key form of health information exchange is consumer mediated exchange. And what this is it provides the patients with access to their health information, allowing them to manage their healthcare online in a similar fashion to how they might manage their financing through online banking or on an app. When patients have control of their own healthcare information, they can participate in their plan of care. They can do this by providing other providers with their health information, identifying and correcting wrong or missing health information. They can identify and correct incorrect billing information, as well as they will have the opportunity to track and monitor their own health. Health information exchange can reduce costs in healthcare by reducing the number of unnecessary tests, unnecessary treatments. It can eliminate medication errors and medical errors. It can also will reduce administrative costs by making tasks simpler and more efficient. There was a study completed where they studied HIE and non-HIE episodes after a physician referred patients from 35 HIE and 59 from non-HIE clinics to SNUBH. They did this study for a 17-month period from June 2009. They examined 9 measures of healthcare utilization and magnitude of clinical information exchange in 4 categories. The total charges incurred by HIE group episodes while they were at this hospital were 13% lower, and the charges for clinical laboratory tests, pathological diagnosis, function tests, and diagnostic imaging were 54% lower, 76% and 73 and 80%. This was for the HIE group, and these were lower than the non-HIE group. HIE technology improved the access that the doctor had to the patient's past information, which allowed them to cut costs by not doing unnecessary tests and labs and so on. So for the non-HIE group, there was more money spent because they were doing duplicate tests and seeking treatments that weren't needed because they could not view the patient's past health information, which will in turn cost more on both the patient and the facility that is performing this treatment because they are doing things that aren't needed or giving medications that aren't needed, which can charge more, increasing the costs for unknown reasons because they can't view a patient's past history and see that they have had all these things done, and those weren't what was causing the issue. So therefore, since they didn't have access to that information, it makes the cost higher. So HIE can reduce costs by allowing physicians to view past health information and only do tests that are necessary instead of duplicate tests over and over again with no results. Health information exchange can make healthcare more efficient by ensuring that everyone who is involved in a patient's care plan has access to all the same information to reduce the number of medical errors. It can also reduce the amount of time that a patient would spend filling out paperwork prior to an appointment, and such as past medical history or medications they are taking or anything of that sort, and this can in turn give them more time to discuss their concerns with their health with the doctor as well as determine a plan of treatment for whatever concerns they have. It can also reduce the amount of time that a patient is telling them about their medical history. So HIE will be able to provide doctors with all of the medical history that they will need on a patient. So whenever somebody comes in, they are not wasting the time that they have for their appointment discussing their past problems or any other concerns that would be listed in their chart, because the provider will be able to view this, whereas it's shared from provider to provider, and it makes it more efficient for a patient to get the treatment that they need, as well as know, like, the patient needs this test because they've already had this one, and the doctor will know that, and then it will prevent them from doing treatment that's not necessary. Health information exchange provides many different benefits. Those include they provide a vehicle for improving quality and safety of patient care by reducing medication and medical errors, which can be a very big problem in healthcare because one small medical error can lead to a lot of other things and can also be very costly. It can stimulate consumers' education and patients' involvement in their own health care, increase efficiency by eliminating unnecessary paperwork. It will provide caregivers with clinical decisions and support tools to provide a more effective treatment plan for a patient. It will eliminate unnecessary testing. HIE can also improve public health reporting and monitoring. It can create a potential loop for feedback between health-related research and actual practices that are happening. Efficient deployment of emerging technology in healthcare services. It can provide a backbone of technical leverage by national and state level incentive. It can also provide a basic level among EHRs maintained by individual physicians and organizations. It can also reduce healthcare costs, which is the #1 benefit of what HIE can do. Electronic health information systems can help prevent errors by ensuring that everyone that is involved in this patient's care, whether it's in a hospital, a specialist, or even just your primary care setting, they all have access to all of the same information. So if you have a follow-up appointment for something, your doctor will already know what you're there for, and they will have all the information that they need. It can also send reminders of follow-up appointments as well as instructions, and it can send these directly to the patient, and it can send prescriptions directly to the pharmacy for the patient so that you don't have to go and drop a medication off at the pharmacy and then come back and pick it up, whereas it's already being sent directly over. I have also included a video on how health information exchange has made a difference for a certain facility. In this video, they discuss the benefits that they have gained from using HIE, as well as they mentioned that when Hurricane Sandy occurred and everything was destroyed and they lost a lot of things such as patients' paper records or anything that was kept on paper. HIE allowed them to still have access to patient health information and keep it stored within the network so that all that information was not lost. It was still there, which was very beneficial for them because they still were able to treat patients, and they also discuss how this has helped them whenever they see a patient because they can view past patient histories as well as if they have seen other doctors and so on and things like that. This video includes information about how health information on this slide, I have included a chart for what HIE would look like from 2013 to 2024. And as you look at the chart, you can see that it is increasing over the years, the number of facilities and people that are utilizing HIE, and by 2024 they expect that there will be a very large increase in the number of companies that are using HIE. It is expected to grow swiftly throughout the years, whereas there's going to be a demand for health information exchange, whereas most healthcare facilities are going to start utilizing this instead of keeping paper documents and other things such as that, because HIE is a much more convenient way to keep patient records. HIE includes many different benefits, and most of these benefits outweigh the challenges that come along with it. One of the number one challenges with health information exchange is the amount of money that it takes to implement this system. But after you have paid the cost of whatever it is to get it started out, you will save more money, as proven throughout the research, by reducing costs and unnecessary tests and so on. HIE is a very good system because it can help healthcare to avoid readmissions, medication errors, improve diagnosis, decrease the duplicate testing. It can also improve the quality of care that a patient receives whenever they are in a healthcare facility, and this can lead to the patient feeling better about the care that they're receiving, as well as they can be involved in their care, and that will help reassure them with the things that are going on with their life. A really good example of how HIE can be very beneficial is if there are laboratory tests that are received electronically and then put into a provider's EHR, a list of patients that have diabetes can be generated, and then the provider can determine which of these patients have uncontrolled blood sugar, and then they can schedule a necessary follow-up appointment. Versus with paper documents, you could still do this, but it would be harder to determine who needs that follow-up appointment, which could lead to people that don't need it having appointments scheduled and having unnecessary testing done, which can be a very costly thing. So HIE's benefits are very good, and they can improve healthcare in many different ways. I have included a short quiz at the end of my presentation to ensure that everyone has a good understanding of the information that was mentioned within the presentation. The first question is, what is one benefit of health information exchange? Number 2, how can health information exchange reduce costs in healthcare? Number 3, who uses health information exchange? Number 4, what are the 3 forms of HIE? And lastly, what is one way HIE can make healthcare more efficient? I added these in to ensure that if there was any questions or people were confused within the presentation, they could answer these questions, and if they didn't know the answer, they could come to me and I could go dive deeper into what each of these mean within HIE.